Hey everyone, I wanted to talk this week a little bit about counseling in different settings. We'll talk about this more in our next live meeting, but I wanted to kind of broach the topic with everybody. So counseling looks different depending on where you're doing it, and I think that as I was reading through some of the professional journey papers, I was recognizing the trend that I usually see, which is many people want to eventually find their way to some sort of private practice or group counseling practice where you're working kind of among other independent counselors in pulling resources or things like that. And that tends to be kind of the ideal. That tends to be what we all envision our counseling practice to look like. Now, not everyone. Some folks want to work in agencies or want to work in law enforcement or the justice system, or specifically in drug and alcohol settings that may be within a larger agency structure, and that's totally fine. There's lots of different ways that we can practice. But I want you to consider some of the things that come to mind, like the benefits and the drawbacks from each of those. So, um, and then also how we might try to practice differently in those different areas. Uh, Counselors are working in, I'll start with one that doesn't come up as much in because we don't have a school counseling program as part of our uh, specialty areas in our program. But counselors in the school setting is definitely becoming a more routine thing. It used to be that there was a movement that school counselors or guidance counselors would align more with being traditional counselors who happen to be working in a school setting. When I was earning my master's degree, that was definitely the movement that was taking place, was this kind of restructuring around, no, we're not just guidance counselors. And I say just, I know that there's a lot of work that goes into it, but we're not guidance counselors that are essentially working on scheduling and managing logistics within the building and things of that sort, or being stand-in teachers for different reasons. We're counselors who have learned how to counsel, who identify with specific theories of counseling and specific approaches to our counseling, and and we are just in the school building, and so we specialize with this population. When I was earning my master's degree, that was definitely the movement that was taking place. And it's very strange to see that. So since I earned my master's degree and got my PhD and now I'm teaching, how that has changed, and it's gone kind of all the way back around to the other side, where now school counselors are learning how to be more so what we would have traditionally seen as guidance counselors. And school districts are farming out those services to community agencies that are putting school-based counseling programs where traditional community counselors are going into the school buildings to provide mental health treatment, which is completely different than how school counseling and the ASCA movement and all of that sort of stuff. Like at one point, ASCA joined with ACA, and that was such a big deal because the school counselors are coming. We're all counselors together. We're joining together, and we're one unified force. And just a couple of years ago, ASCA broke from ACA again, and now they're two separate entities again. So it's very strange to me, who's not a school counselor but has worked in some school settings before, to see this movement and this shift. But so you may become a community counselor who works at an agency where your agency is providing school-based services, or you may be a community counselor who's just being brought in for consultation reasons, or for, if something, some sort of tragedy happens at the school or something like that, they'll bring community counselors in to help with those services. So there may be a reason why you need to be aware of your local school districts and their policies. I think the school is a good setting to start talking about this, because the school is going to have certain restrictions that are in place. And so you, as a counselor who are operating within the school, have to keep in mind your code of ethics and perhaps how you've been trained to counsel and your theoretical approaches. But once you enter the school building, you fall under their policies and procedures as well. It's not instead of. And so it becomes kind of challenging to navigate some of that stuff, because they may have, but so you want to ask, you want to know what they expect of you and try to consider that stuff ahead of time. Like they may require that CYS calls to children, youth and family services have to go through a principal or assistant principal before they can be just directly called in. That doesn't mean that you can't call in a CYS call independently, but you still have to follow their chain of command ideally first. And then the details of like how you would overstep that, or whatever you would need to do, or conversations that you need to have with an individual supervisor, and would be very much situation to situation. But you have to keep in mind that you're operating within that structure then. Similarly, at a community agency, you will have rules and regulations that you're required to follow that may be handed down from the state, that you have to follow above and beyond the training that you've been given and what you're used to practicing as a counselor, because that agency is going to have policies and procedures that are in place. The supervisor becomes the supervisor of record, and so if a supervisor, like, we're allowed to question what it is that we are being asked to do as a counselor, but you can't outright undermine your supervisors, because they have an ethical and legal obligation as supervisors to provide direction. And if they provide a given direction and then you alter that, now the liability may fall on them. And you may have created that problem. So it adds just another layer of considerations for how you practice. The plus to a school setting and an agency setting is you don't have to do a lot of work to get your clients in the door. There's not as much effort to find a location and cover costs and manage referrals and things like that. My wife and I were just talking about this recently because we're trying to make some decisions around what she wants to do with her practice in the future, and ideally, how she likes the group practice that she's in, and they help her with referrals. And so that's become kind of a benefit for us, because we don't have to pay for advertising or try to go out and figure out how to draw clients in or anything like that. The agency, it's not an agency, the group practice handles all of those needs. So an agency has its benefits, and I've known some folks to come through the master's programs that I've taught in and just want to be agency counselors. And again, I say just, and I don't mean that as a minimal thing. There are benefits to that. They have their taxes taken care of for them. They have their healthcare benefits taken care of for them. They don't have to worry about referrals coming in. Now, you may be required to exist within a productivity system where they want you to see so many clients and you're only paid for the clients that you see, or they may have a rate where they give you regardless, but they want you to hit X productivity standard. So these are some of the logistics that come into play. Private practice is great for a lot of reasons. You can practice with whatever theoretical orientation you want to. In certain agencies, they may require you to practice using a cognitive behavioral approach. Or like when I was in family-based, we had to do everything through a structural family therapy approach. That didn't mean that I couldn't use different theoretical approaches with my clients, but when I would document things or when I would have my supervisions, I'd always have to keep in mind, and one of my supervisors in family-based used to talk about this, you can do anything that you think is going to be helpful to the clients, but when we document this, it's always through the lens of structural family therapy. So like my language always had to be filtered back through, what would a structural family therapist say about this? What was, there are interventions that are sometimes similar across different theories. And so I might be doing, a rewriting exercise that's more of a narrative approach there, but I have to write it as a restructuring exercise. They basically look the same when I'm doing it as a counselor, but the agency required me to practice using structural family therapy. So when I documented my sessions, that's how I documented them, through structural family therapy. When you're in private practice, you don't have to do that. You can use whatever approaches you want to use. The catch is, though, you certainly are only going to get paid when you see clients. You're not going to get an hourly rate from the insurance company. If the clients don't show, you don't get paid. Whereas at an agency, you may get some sort of a partial pay for you being present. You get as many days off as you want in private practice. You want to take a vacation and tour Europe or something like that? Fantastic. Just schedule yourself off properly, have your backup systems in place so that if a client has an emergency, they know where to go. You can do that. Now, you don't get paid, but you can do that. And that flexibility is sometimes really, really attractive to folks. I know it was attractive to me. I'd been under productivity standards for years working at agencies, and I just got tired of it. I didn't want to be told that I absolutely must see, 60% of my sessions, because some of that's out of my control. Like, I can't control what the clients do or don't do. But then I had to figure out my own advertising, and I had to figure out office space, and I had to figure out how to cover the costs of office space. I don't drive past many places anymore where I don't consider parking. That's a strange thing that I never used to think of, and I probably should have. But when I was first looking for office space, I never considered parking, because I just figured if I get a place where I have my office set up, the clients will come and find me. And that's what we'll do. And they did, but sometimes they had a very hard time finding parking in the city where I was practicing. So, I think about that. Like, what's the give and take for office locations? Is this worth the cost? Can my clients even get to me? Insurance companies ask those sort of things. They ask, if you're going to contract privately with an insurance company, are you on a bus route? Do you have handicapped accessible access into your facility? You may think that you have nothing to do with that, and you don't, but that will determine whether or not they contract with you, and that will also determine, maybe they'll contract with you, but they may put you on a list of, only this particular clientele will be recommended to you because you only meet XYZ criteria, things like that. You also have to consider, when you're in private practice, how you advertise, how you say what it is that you're doing, and get that information out there. I do very much recommend getting, regardless of the way in which you practice, I do very much recommend getting involved with different community agencies in the area. We talked about this already in class, keeping a binder or some sort of Rolodex. I know we don't all have Rolodexes anymore, but keeping a portfolio of all of the different agencies and practices and services in your area, so that you can provide that if clients need it. It's better to have it and never use it than to need it and have to dig it up. Yeah, and it'll never be perfect. You'll never have everything, but that kind of affiliation opportunity is really, really helpful, particularly when you're in private practice and you need referrals back and forth. But also, when you're in an agency and your client comes up needing something and the agency doesn't offer that service, it can be very helpful to know what's out there. So those are different ways we practice in different domains. The theories that we use tend to be what aligns with you, because a theoretical orientation has a lot to do with your outlook on how people change and how you're going to intervene. And you will never perfectly align with a theory, but we try to get folks to think about, like, what is your primary, or maybe two primary theories, and then what are your secondary theories that support those. Like, my primary theoretical orientation is existential counseling. That's how I think about my cases. That's how I think about problems. And when my clients present stuff to me, I always filter it through an existential lens. That wasn't always my primary. I used to be much more person-centered in my approach. That's still an approach that I go to. My secondary theoretical orientations tend to be narrative counseling, Gestalt, and structural family therapy, because I learned so much of that. I don't tend to like cognitive behavioral approaches. That doesn't mean that they're not effective and that many people don't love them and use them very effectively. It's just not something that aligns with the way that I think about problems. And you will have time to get into theories of counseling when you take that course. But I just want you to start thinking about how I think about my cases, how I think about the work that I'm doing. And you can do this by watching a movie and thinking about how you think about the different characters and how their problems have evolved and how they interact with other people, or think about your own families and your friend groups and things like that, and how things change and how people operate and how they look at the world and how you look at the world and how those things match up or how they diverge. That's going to start getting you thinking about how problems happen, and then also how we try to correct them to the best of our abilities. Those theories may change based on the environments in which you work. It's very common for drug and alcohol counseling offices to really identify with cognitive behavioral approaches. It is very common with community agencies to either have a cognitive behavioral approach or to have a structural family therapy lens or a strategic family therapy lens that they want you to practice through. We very rarely hear about agencies that want to require you to use psychodynamic theory, which is the more modern version of psychoanalysis, Freud's theory. We very rarely hear about agencies that want you to practice using Gestalt techniques. But that's not to say that they don't exist, but I've not heard them. But that doesn't mean that you have to stop thinking about things the way that you think about them. And that doesn't mean that you can't work with your clients through whatever method that you develop that kind of connects and interweaves with the different approaches that you want to utilize. It just means that you may have to then filter everything through that lens, because that is how the agency or group has structured things. That's how their contract works in that case. They have put forth to their funding source, whether that be an insurance company or the state or federal government, this is how we're going to deliver services. And then that becomes approved. And so if you don't do it that way, you are breaching contract with your payment sources. So, Hopefully this gives you kind of a light into the different areas that we practice. Counselors practice all over the place. I'm trying to hit like the main few that I think of: agencies, private practices, and schools. And schools is to a lesser degree for us, but it's still there. But we might practice in in veterans hospitals or in a hospital setting in general. We may practice I've known counselors to be working with sports teams. I knew a counselor who worked with the Pittsburgh Steelers. That was how she began her practice and worked there. Certain community agencies may staff a counselor as part of the work that they're doing. Westmoreland Community Action in my area does a lot with housing assistance, but they do have mental health counselors on staff because there's lines crossed there, that there are needs. So counselors practice in a lot of different settings, and we want to adjust our practice to meet the needs of the setting that we're working in, while also remembering how it is that we tend to approach the work that we're doing. And that is very complicated. And there's no specific one-way answer to any of this, other than to get you starting to think about how you see the world and then modifying it, the way that you look at things after the fact. But you need to start thinking about how you see the world first. That's step one. So hopefully this was helpful. Look forward to seeing you in our next live meeting, and certainly reach out with any questions, comments, or concerns.